Hello, my name is Paul Delgado. I am Latina. I was born in Oklahoma and raised in Mexico City. I am now a third-year medical student at OSU College of Osteopathic Medicine, and together we can elevate med. I knew that I wanted to be a doctor since I was around 6 years old. There's nobody in my family that's in medicine, but I knew that's what I wanted to pursue. And I also knew that the best place where I can get the best education was the US. So at 13, I decided to leave Mexico, decided to leave my mom, my brother, and moved to Oklahoma with my aunt. I didn't know anything other than the ABC. A few years later, though, when I started volunteering at community-based clinics, I realized that a lot of the people that I was working with were immigrants, were people of color, were people that had many issues other than just not having access to healthcare. That's when I realized that although I didn't know at 6 years old and I didn't know when I first moved to this country, I knew then that one of the reasons why I was pursuing medicine was to be able to address many of the health disparities and health inequalities that are present and has been present for years in many communities of color. I will pursue a career in internal medicine and then cardiology as a subspecialty. We know that heart disease has continued to be the number one leading cause of death, and we also know that there's a huge disparity when it comes to Spanish-speaking cardiologists and Spanish-speaking physicians. In fact, less than 6% of currently active physicians identify as Hispanic Latino. So, from personal experience, I've seen the way that disparity impacts our communities and my family. My uncle, who was living in LA, was about to undergo a heart procedure, and there was nobody that could explain to him in Spanish what was going on. Instead, he had to call me. A few months later, he passed away from heart complications. So I always ask this. Imagine that's LA. What happens in smaller cities like Tulsa and Oklahoma City where there is a lower number of Spanish-speaking providers? I am a huge believer that I should not be the first one to come. I should be one of many more to come. And I also know that I've benefited from mentorship throughout my entire career, from undergrad up until med school. And I think I've tried to do the same, giving back to the future generation of medicine. So I mentor undergrad students, also first and second year medical students that are at my current institution, and also at a national level. I believe that my institution lacked a little bit of support for our Hispanic Latino community and medical students in general. So I decided to fund the first Latino Medical Student Association in the state of Oklahoma. I later went on to serving at the regional level for the Southwest region, and most recently I've been involved as the National Academic Affairs Chair for LMSA. So this is to say I am passionate about giving back. I am, because that's the way that I that's why I'm here, and I wouldn't be here without my mentors. And so giving back, also giving back to the community. I've been involved with many community-based organizations where I recruited many of the LMSA members, and we help with screening for blood pressure and for hypertension. And hopefully us being in our communities allows us to build a little bit more trust and just be able to hopefully make an impact. Over the past 3 years, the COVID-19 pandemic has brought to light many of the health disparities and inequalities that exist in our country. However, for many of us that are part of those communities and have done years of advocacy to be able to address many of those issues, it has not been nothing new. So why do I want to be part of ElevateMeD? Because I want to make sure that I learn from experts in the field, people that are passionate about addressing many of these issues, and people that are actually and actively working on this. If I can say one thing to the donors and supporters for ElevateMeD, I promise you that I will be one of the hardest working people in the room. And fortunately, I think that being intentional about the things that I am involved in and being intentional about what I'm passionate about has allowed me to have access to a lot of opportunities that I plan on giving back to the future of medicine. Thank you.